ultimately, I always try to get patients to be comfortable seeing the dentist without a need for anything. But there are so many ways to overcome barriers. There's conscious sedation, where you're essentially taking something beforehand, and you can combine it either with nitrous, or you can just take it before, 1 hour before, and bring a little bit during your appointment to keep you comfortable throughout. And those are ways that we overcome barriers for people who might have kind of like childhood trauma, or have just never been comfortable with the noise of a drill, or just being in the dental office in general. Throughout, the 10 years that I've practiced, I would say 20 to 30% of the patients that I've met who've had dental anxiety, who just give it a chance, and they get to know you, and they realize that, with local anesthetic and just being comfortable in the chair, just through trust of kind of the clinicians and the assistants, we're able to get a lot of people off of those kind of protocols to get them comfortable in the chair, to the point where I've even had people fall asleep in the chair during procedures. It takes kind of a history with the patient to figure out where they fall. But there are definitely different ways to keep them comfortable, either with medication or just with trust. And ultimately with trust, that's kind of where we get people to the point where not only are we able to get them in the chair without medication, but we're just able to get them to kind of just accept their need for treatment. We have a lot of people who we've met who have avoided treatment for so long that now it turns a simple procedure into a very complicated one. And that's like ultimately what we try to avoid. But yeah, I mean, there's a handful of different kind of metrics you could use or medications that you can use to get people comfortable in a chair. But ultimately we try to do it as naturally as we can.